Hi, I'm Dr. Barry Cohen. As you know from being here, I'm a board-certified plastic surgeon. The purpose of this segment is to give you some sample of what it's like to get a breast augmentation consult in my office. Breast augmentation on a national level is now the most common cosmetically performed procedure done in the United States. It's taken over from liposuction last year, which I will talk about also under another icon. But the purpose of this is to take you through the consultation of what you would typically get in my office about breast implants. Breast implants here take approximately 15 to 30 minutes. It's done in my office. We have a triple HC Medicare approved surgery center right in-house. Most patients are in and out of our office in under 2 hours. The surgery takes place while you're asleep. Most of our patients who are getting breast augmentation have what we call an IV general, which means that you're completely out, but you're breathing on your own. That also means you have very little risk of getting nausea and vomiting, which is not only unpleasant, but also causes complications such as bleeding because of your blood pressure that goes up. Not having general anesthesia is also beneficial because you have little or no risks of developing blood clots in your legs, which can come from any general anesthetic. The surgery is not completely painless, but it's not a huge recovery. My average patient is back to driving in day 3 or 4 after surgery and is back to a sedentary job at that point and most of their activities of daily living by usually day 3 or 4. I ask that my patients don't do any significant lifting or straining for about 10 to 14 days after surgery, at which point you can start aerobic exercise. Upper body exercise can be resumed at around 3 or 4 weeks, and most of my patients tell me it takes about 3 or 4 months to get over having the implants completely, to feel completely back to themselves and have the implants feel like they're part of their body. There's a lot of misconceptions about implants, and I want to take you through some of those now. Number one is that silicone gel implants are the best or better than saline. That's not quite true. And I want to take you through some of those pros and cons of silicone versus saline. As many of you know, silicone was off the market for mainstream use for approximately 14 years. The reason they came off the market in 1992 is that there was some concern that silicone gel caused autoimmune disorders, which are a group of diseases in women that cause the body to attack itself. There wasn't a lot of clinical data at that time, and in reaction to many of the women's organizations out there who were concerned about women's health, David Kessler, the head of the Food and Drug Administration in 1992, pulled silicone implants off the market for mainstream use pending testing. Well, the testing's been done and done and done and done again. There have been dozens of studies that have come out from Harvard Mayo Clinic, a 10,000 woman study out of Sweden, and in fact absolutely not one of the studies showed that there was any significant problem with silicone gel implants in autoimmune disorders, and they have been put back in the market for now over a year for mainstream use. You need to be 22 to get them, but anybody can get them for cosmetic reasons. There are some pros and cons to silicone versus saline, and I want to take you through that before we go on any further. Silicone gel feel a little bit more natural because they're softer than saline implants. Silicone gel costs a little bit more money because of all the litigation I suspect that transpired, and the cost to manufacture is a little bit greater than the cost of manufacturing an empty bag which is filled inside the body. Silicone gel, however, have no marker for immediate rupture. What do I mean by that? All implants are going to break in your lifetime. The companies that make implants, both Mentor and Allergan, warranty implants for your lifetime, but we tell most of our patients that they were going to break. Silicone gel implants are suggested to be surveyed with an MRI every several years to look for rupture. Saline implants, unfortunately, have an immediate marker for rupture in that when they break, you go flat. You hope you're not on a beach in Aruba at that time, and then one's up and one's down until you can get them replaced. And I always jokingly tell my patients you should carry a big hat pin around with you so you can pop the other implant until you can get them fixed. I didn't really tell the patients that, but the point is that there is an immediate marker for rupture for saline implants, and it's a very easy procedure to get the implants exchanged. When silicone gel implant breaks, either nothing happens or patients get a slow hardening called a capsular contracture, which is one of the complications that can happen with either silicone or saline implants. Silicone gel have a typically larger incision requirement because they go in filled, whereas saline goes in nearly empty and usually has a smaller incision. there are usually more choices or options for insertion points for saline versus silicone gel. For example, saline implants can be put in through the areola, they can be put in underneath the breast, they can be put in through the armpit. Some doctors, although not me, put them in through the belly button, and they can be put in through a tummy tuck incision if you're getting a tummy tuck done at the same time. Silicone gel have more limitations because they go unfilled. I strongly suggest not going through the armpit. Many women's areolas are not large enough to insert some of the implants, so they're forced to go into the inframammary fold. And that's okay, but the scars tend to be a little bit more visible than the other choices. The other advantages of silicone gel is that you do not see as much rippling, which is a risk of saline implants. As when you hold up a bag of salt water, they tend to have ridging or buckling of the implant, which is typically not as visible with silicone gel. Saline is actually a little bit easier to correct for people who have mild asymmetries, and many women will actually have disparity in the sizes of their breasts from one size to the other, and it's much simpler to correct for those asymmetries when you're using saline implants because you can actually fill them when they're in the body. But overall, they look the same. Saline implants have a slightly lower rate of hardening, called capsular contracture in general, which is a risk of the surgery. That's in the low single-digit percentile for both silicone and saline, but saline is slightly lower. All that being said, women can achieve the same beautiful results with silicone or saline. I think one of the biggest misconceptions about implants is how to pick an implant size, and I think that if you look at our practice and look at what separates us, the selection of implants and the choices of implants are really very different for many doctors. In fact, now compared to even 10 years ago, there are many more choices in the styles and shapes of implants. As many people have heard, you have both round and you have teardrop shaped implants. Most doctors now only use round implants because the studies have shown that when you are under the muscle, which is the only place that I'm going to put implants, submuscular implants look the same even on mammography as they do in real life, and you get a very natural taper when you go underneath the muscle. And that's the only place that I'm going to put the implants because mammography is really essentially unimpaired. There is no increased risk of breast cancer, by the way, but you don't want to do anything to impair the detection of breast cancer, whose risk is the same with or without implants. So going under the muscle is critical, not only for the detection of breast cancer reasons, but also because they look more natural. So as long as you're under the muscle, most doctors are using round implants. Well, that being said, there are many different styles of round. How is that? Well, people come into my office all the time, and they've been to many of other doctors' websites, and they'll see an implant and they'll say, that 300cc implant looks great, that's what I want. And I'll pull out my bag of tricks, and if you look at my table in front of me, you'll see 3 different implants. And if you look at the side profile of these implants, this one is a low profile 300, this one is a medium profile 300, and this one is a high profile 300. This one's short and flat and wide, and this one on the other extreme is narrow and tall. Well, they will both produce all of these implants would produce rather different results in the same person. So how do you know what's right for you? Well, the right way to pick an implant is to look at the dimensions of the patients, to measure the width of their chest from midline to the outside of their breast, to look at how tall they are, and also to look at how big they are currently, because what you currently have is going to be added to by the breast implant. So if the table is one woman's breast and this implant is another woman's breast, and I take this implant and put it here and put it here, you're going to have 2 very different outcomes in terms of cup size. Another misconception is, what is a cup size? Well, the number of your breasts or the circumference of your chest does not change typically with breast implants. So if you're a 34 or 36, that should remain unchanged. What does change, however, is the cup size of your breasts. If you're an A cup, that means that your breast sticks out 1 inch from your chest wall. B cup 2 inches, C cup 3 inches, D cup 4 inches, and so on. And so what we're trying to achieve for a patient is a very natural look for an implant that's not too wide so that it makes you look fat, and not too narrow such that you have no cleavage and not enough superior volume up top. So we pick an implant whose dimensions, both in width and in projection, will give you the appropriate augmentation of your breast and to give you enough projection to achieve the goals that you're looking to achieve. So if you come in and you're an A cup and you want to be a C, then I'm typically going to offer you a high profile implant whose projections in this family are going to be along the lines of 2 inches. If you're a postpartum mother and don't want significant addition of volume or cup size, but just want restoration at the top of your breast, which is a common complaint of postpartum moms, I'm going to use a low profile implant because that will achieve your goals. So, that being said, that requires measurements and a free consultation with me. So please come in and we use all of those implants in the range of our augmentations. So what are the other misconceptions? Well, you can breastfeed after implants. There's no problem with that. Now, it's really impossible to tell you what your breasts will look like if you do get pregnant with or without breastfeeding, because your breasts will go through changes of pregnancy, and that's something that only time will tell. But certainly breastfeeding is not a problem, and that's regardless of where you make the incisions. You will have no restrictions in any type of exercise after 3 months. You can jump out of a plane, you can go scuba diving, there's no problems with that. The scars are typically minimal from breast augmentation surgery, and the results can vary anywhere from 1 to as much as 2.5 to 3 cup sizes up from where you are right now. In fact, breast implants will often give you significant lift. So people who've had some droop to their breasts or a little bit of droop to their breasts can often be completely corrected with breast implants alone. That's with saline or with gels. Finally, it's important to know what the basic risks are associated with the implants. Implants can become infected. If an implant were to become infected, it needs to come out for several weeks to a few months afterwards to clear the body of the infection. Fortunately, this is very rare. In my career of over 5,000 breast augmentations, I've seen only 2 clinically significant infections that required implant removal. Rippling, as we said, is a problem more likely with saline implants than with silicone gel. So too can be a capsular contracture, which is in the low percentages. Capsular contracture is where the body forms a hard scar tissue pocket around the implant, and it requires more surgery to break up. Unfortunately, you can't predict who is going to be in that 1 or 2 or 3% that gets that, but suffice it to say that if you were to get it, it's not terribly complex to fix the problem, and by going in and either breaking up or removing the scar tissue shell, that typically will eliminate the problem. You can lose sensation to your breast. That is also very rare, and that too is regardless of where you make the incision. The nerve that gives you feeling to your breast comes from the 4th rib space, deep, and we try to stay away from that nerve. But it is possible that it can be a permanent numbness to your breasts. I've seen 1 or 2 in my career patients who at a year have numbness. In fact, most women get hypersensitive or increased sensitivity immediately after surgery, which can last for several weeks, but that goes away. Scars are really minimal, so too is the risk of bleeding. Major complications are extraordinarily unusual, and as I said earlier, everybody is likely going to rupture in their lifetime, and you need to expect to have the implants changed. Most of the implants are warranted for the first 10 years for replacement cost as well as the implants, and the implants are warranted forever beyond 10 years. That goes with you, not with me. So you can get replacement regardless of whether I'm in practice or not, and hopefully I'll be here for a while, but you could have moved out of state or out of country, and the warranty goes with the patient. Patient satisfaction rate for breast implant is enormous, and I think that if there's any complaints, most people wish they went larger. So one of the things I encourage people to think about is to think about really how big you want to get. Don't worry about what your neighbor thinks. Do what you want to do. Try to become proportionate, and most people are extremely happy with implants, and very few people ever regret the decision. The reasons to do breast implants are to make yourself feel better about yourself, to be more proportionate in clothing, to be able to go out and buy clothing that fit, and to feel as good as you can possibly feel. Is it a life-changing event? For some people it is. For most people it just makes them feel more confident and more comfortable in their body, and to feel more confident and comfortable in a bathing suit, but most importantly to be able to go out and buy and wear clothing that are fitting for and proportionate for them. We do a huge amount of breast augmentations. We're happy to do it, and our prices are always extremely competitive based upon the number of breast implants that we do. I look forward to meeting you in person and answering any more questions that you have about breast implant surgery. Thank you.